The moment you start having labor-like pains before term, that is, you having labor pains before reaching 37 weeks of amenorrhea, or around 8.5 to 9 months, that should be a very big worry, and that should be a very dangerous sign that you should rush into the facility. So the moment you start seeing blood, that should be a worry. That should be the very first danger sign in pregnancy. You should visit your health service provider very early, the moment you start seeing blood. That's a very big danger sign. Hello everyone. Hope your life is well. You're talking to Dr. Jamil. This video will talk about the danger signs in pregnancy. Remember, we are still following our maternal child health series. So what is a danger sign, particularly in pregnancy? A danger sign is anything that when you see proves to be dangerous either to you or your baby during pregnancy. And to understand danger signs in pregnancy, we shall divide into early pregnancy, that's pregnancy before 20 weeks, and late pregnancy, that is pregnancy after 20 weeks. Some of the signs will be overlying both in early pregnancy and late pregnancy. So, as we discussed, danger signs are things that would be dangerous both to you and a child and might present and you see them. So we normally call them danger signs, but at times they are also symptoms. A sign is what we see and a symptom is what you tell us. So as you come to the facility, you might be knowing we might only see signs, but you are the one to tell us the symptoms. So what are the danger signs in early pregnancy? When you get pregnant and your HCG is positive, it means that other hormones are down, so we are not in position to provide to go into our normal menstrual cycle. So we don't expect to see blood in pregnancy. So the moment you start seeing blood, that should be a worry. That should be the very first danger sign in pregnancy. You should visit your health service provider very early, the moment you start seeing blood. That's a very big danger sign. Now, the blood we are talking about is the pervaginal bleeding or blood that is coming from your private parts. Now, you might have another form of blood that is called hematemesis, or vomiting blood-stained vomiters. That is a very dangerous danger sign, and the moment you see it, you must report at the health facility very fast. The third one that you should look at is hyperemesis gravidarum, excessive vomiting during pregnancy. The Banyankole normally call it okutanaka munonga wabo inenda. So that's a very dangerous sign. Vomiting in pregnancy is normal, though we expect you to vomit early in the morning and not more than twice. So the moment you start vomiting more than 3 times, or the moment you start vomiting everything that you've eaten, you should come in the health facility, in a hospital or any health service provider and seek for assistance. The other very dangerous thing in early pregnancy is severe lower abdominal pain. So ideally we expect a pregnancy to be in the uterus or intrauterine, inside your uterus. So the moment the baby goes outside your uterus, whether in the tubes or in the ovaries, you will start experiencing a lot of abdominal pain. So when you see that, visit your health service provider very fast, because it is very dangerous to both your health and if the baby is growing, maybe to the baby. So in early pregnancy, still, if you develop fevers, a fever is any temperature that is beyond, for a layman, let's go for 37 degrees Celsius, but in medicine, normally go 36.5. So the moment you start developing fevers or having a lot of headache, kindly visit your health service provider. So the very last sign that is in early pregnancy that you should rush for is having an abnormal vaginal discharge. So during pregnancy, very many women don't normally experience this because of the high progesterone that produces a thick mucus, that mucus protects you from having ascending infection. But when you receive an abnormal discharge in pregnancy, that would go on to infect the baby. So kindly visit your health service provider earlier. So those are the signs that we normally see in early pregnancy. What can we see in late pregnancy that should worry us? And we go into the health facility. So in late pregnancy, all the signs that are dangerous in early pregnancy can also be dangerous in late pregnancy. So we agreed that bleeding, we agreed that severe lower abdominal pain is dangerous. We agreed that excessive vomiting is dangerous. Vomiting blood is dangerous. Vomiting blood is dangerous, and then having headaches and fevers is very dangerous in your first 20 weeks of pregnancy. So what would be the danger signs apart from that after 20 weeks of pregnancy? We expect people to start feeling fetal movements at around 20 to 25 weeks. So the moment you've been hearing your fetal movements and they disappear, that is very dangerous, and you must visit your health service provider in case you report reduced fetal movements. Another danger sign that we shall see, the moment you get a puffy face or the moment you start getting swollen feet, in pregnancy, it's normal that you'll have edema or your legs will swell. But the moment they swell excessively, then that's a danger sign that might show that you may be developing conditions like preeclampsia or eclampsia that need urgent attention. The other danger sign that you'll get in pregnancy will be having fits or convulsions during pregnancy is a danger sign that you should look out for in pregnancy. So we saw that an abnormal discharge is dangerous, but in pregnancy you might have leaking membranes and you have a watery discharge. So the watery discharge should be considered as a danger sign. Since if you see water moving down your thighs, that shows that your membranes have ruptured, and that should be something dangerous that you should visit your health service provider very early. The other danger signs in pregnancy would be severe epigastric pain and severe headache. That would show features of both preeclampsia and hypertension in pregnancy. So if you have that, visit your health service providers very early in order to get treatment and have prevention. And the other danger signs that we are supposed to look out for every pregnant mother, that we should seek health attention very, very early, is the moment you start having labor-like pains before term. That is, you having labor pains before reaching 37 weeks of amenorrhea, or around 8.5 to 9 months. That should be a very big worry, and that should be a very dangerous sign that we should rush into the facility. The danger signs are very many, and we cannot discuss everything to the dot. But we believe that most of the important danger signs during pregnancy have been discussed. So thank you for tuning in. In the next videos, we shall be looking at what can result into a cesarean section or a normal delivery. This aids us in having informed decisions during pregnancy and helps us to have a timely and safe delivery. Thank you for tuning in. See you next week as we discuss the reasons why we can have a cesarean section, and these cannot be discussed unless we have tried to understand labor and signs of labor. So we shall see labor and signs of labor, such that when we see the abnormalities of labor, you can easily know that you are going for either a cesarean section or an assisted vaginal delivery. Thank you so much for watching. See you next week. Thank you so much.